and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
All right,
Bob.
Brad, today we're going to talk about the 4 signs that your back is about to go out. I mean, you know that situation where you can't even walk or can't get out of a chair or can't get out of bed?
Yeah, we both experienced those.
Yeah, we both experienced it. My father-in-law it used to happen to him a lot. He actually had to call the ambulance one time. He had to crawl out of his bedroom to, you know, I mean, it's bad when it happens. So,
right.
And these are the signs it's about ready to happen. You know, this is severe back pain about ready to happen. And a lot of times there's little clues that are going on.
Sure.
So Brad and I being therapists, we noticed the first one right away. And that's if you're in what we call the C curve for a long period of time.
And he's talking about the spine.
So this is the spine, you know, this is where the head would be. This is where the pelvis and the legs are going to be. And this is a side view. So I'll go the same side view as Brad is right now. And he's in that slumped position.
Yeah. It can be like this, like if you're in the bleacher and there's no backrest.
Or if you're at a computer chair.
A lot of times. I like it when patients come in and they have back pain and they're sitting like this telling me about their back pain.
Yeah, exactly. Yeah, you know, and usually a lot of times what we see is people are stacking events. That means they go from one thing where they've bent their back, and like I had a gentleman that was cutting his lawn in the morning, which he thought, well, when you're riding lawnmower, he goes, why is that a problem?
Right,
you know?
just sitting there.
But he's sitting there in a kind of a bent position, and he's bouncing up and down.
Right, right.
And that's the worst thing that can do.
Right, so you got those discs just taking a
you're
beating.
putting pressure on that. He went from that to a 2-hour car ride, which, again, he had bad posture.
Right.
And then finally he gets out of the car and he's going to take something out of his trunk.
Which is the hardest thing to get good body mechanics.
Right. He's leaning over his trunk and boom, his back goes out. Right. So no surprise. Yeah. So if you're putting your back in that rounded out posture for a long period of time, you're headed for an incident.
Right.
I mean, I can guarantee you.
For that.
Yeah. So, and the problem is a lot of people, number 2 is a lot of people have bad posture and they don't know it. They think they're sitting up straight. A lot of times they don't notice it until they see themselves on camera or they see themselves on film, which you and I kind of noticed when we first started doing these videos. Our posture wasn't that good.
Right, and we're aware of it.
Yeah, we thought we were aware of it. But your body has this thing called position sense where after a while, this starts to feel normal to it, and this feels abnormal, sitting up straight. So you need to have someone look at you, and we'll have to do one of those videos, Brad, where we assess posture sometimes, so people know how to do it.
Exactly.
The third thing, and this is a big one, is if your back starts to feel tired or just tight. People hear people say that all the time. My back, it feels tight and tight. It's not really painful. You're about to have an incident. That's pre-pain.
Here's a big one. If you're sitting, probably in that poor posture, getting out of a car, off of a chair, sitting for any length of time, and you get up and it's hard to straighten up.
Yes.
And then once you get straightened up, it feels good, then you walk around and you're fine. Then you forget about it. You are probably right on that gray zone of getting a back injury.
The other thing is if you haven't been staying active, you know, like walking or something, like getting some exercise, getting some blood flow to the back, that's another thing that's going to contribute to the back pain occurring.
And walking is really nice because walking typically promotes good posture.
Right.
You know, unless you're walking like this, but most people are more upright when they're walking.
Exactly. Walking is a great one. Even if you hurt your back, if you can walk, it's a great thing to do for a half hour even. I mean,
as long as it doesn't irritate
it. It doesn't irritate it. So what to do if you're seeing some of these 4 signs, what should you do? One, you want to start by doing what we call press-ups.
Sure.
And this is the vast majority of the people this is good for. There's a few cases where it's not, if this hurts you. But what you're going to do is going to go ahead and lay down flat like this. And you can rest just for a little bit here just to get the back acclimated. And then you're going to put your hands below your shoulders here. And it's like doing a push-up except you leave your pelvis down.
Yep, so I'm going to use my cane here for a pointer, but right here you can see, just like there's a belt around his waistline.
Yeah, what we don't want to see is this.
Yeah.
Where you're lifting up, because your back might be so tight that when you start coming up here, it actually lifts up off the bed.
You got pretty good range of motion. Why don't you go up as high as you can? This is normal.
Yeah.
Okay. Usually, if you're in your 60s or 70s, maybe not so much.
Right.
But I've seen people, and so has Bob. They might only get up if they get
this far.
You know, and it's like, whoa.
Yeah. If you're tight, that should be another sign, Brad. Actually, if this is tight, and you can't go up, you're about to have an incident.
Sure.
So you can do press-ups. You can do, and with me, actually, it was more my mid-back that went out that time, Brad. So I did hallelujah stretches.
Oh, yeah. He's not going to sing the song.
By the way, if you're standing and you and don't have a place to lay down, you could even try some of these back bends, for down here. You put your
Sure.
hands right on the pelvis and go back like this and do
Right.
some press
Right.
ups that way, basically.
That's like if you're doing a job where you're standing, bending over, or like at the kitchen, in the kitchen doing dishes, and you find yourself bending over.
Yeah,
That's a good time
It's like
to-
the pregnant woman, right? Every time the pregnant woman kind of bends forward and she goes like this, you
Yeah,
see them doing
that-
this all the time.
yeah.
So, all right. This is for more of the mid back. If you're having trouble with that or you're feeling tightness there, then you're going to go ahead and what we call the hallelujah stretch. You're just going to bend over to the back of a chair. It's nice to find a chair maybe a little bit lower than this.
Yeah, look, this. Turn it this way a little bit, Bob. Bob, you got thread on your shirt.
Oh.
What are people going to think?
Do you have that ball, that little ball?
Yeah.
Because actually, yeah, if you have a little ball, this works great. If you put that behind your back, now you can really put it where you need to put it, and you can bend over that ball, and it gives you a nice little extension. That's really a nice invention, Brad, that you presented to us.
And one thing about that, if you're going to use that ball, it should feel good.
Yes.
If you do it and it's like, oh my gosh, that hurts, don't think, oh, I'm going to push through it because they told me to and it's going to get better. It should feel like a good stretch. It's relieving the stress, not creating it.
A good set of 10 for both of these. You can do a set of 10 on these, and you can do these quite often, Brad. You can do these every hour if you want. And you can also put your hands like this and bend back.
Sure.
So this one feels good, Brad. I really like that one.
Yep, it is. If you don't, usually we have those bigger balls, those softer ones that you use for kickball. Those are nice.
Right. The ones you could buy at Walmart or some big box store.
I actually like my office chair. It has a soft back and it only comes up low.
My office chair, same thing.
Yeah.
I think I chose it for that reason.
Don't tip over with it though.
All right, the third thing you want to do is if you are feeling some, those symptoms, is going for a walk does help. I mean, like
Sure.
we talked about,
Yep.
just getting more oxygen to the area and getting movement,
Yep.
and all those things can help prevent that back from going out.
One warning about a walk is the surface you're walking on. I would avoid walking up hills because that's going to create you to lean forward just to keep your balance.
Yeah, that's a great point, Brad.
And if the road is on, what do they call that? It's tilted
Kind
like.
of camber?
No, the road, so the water drains off the road.
Right.
It's got that tilt on it. And then you're going to be walking with one leg is going to be actually lower.
Right, and it'll put pressure on one side of the back.
Yeah, so try and get a flat surface. Sidewalks are a little bit better.
If you do go down one side of the road, come down the same side, so
Right,
you even it out.
even it out, yeah.
So, all right, what happens if your back does go out? Just real quickly, what we tell people is to take AIM, A-I-M.
Aim.
Yes. You didn't know that, huh, Brad? Okay, the first one is an anti-inflammatory. A
Okay.
stands for the anti-inflammatory. Ibuprofen or something. Maybe I should link that up. That video on how to take ibuprofen.
Oh, right.
Yeah,
Yeah, that's
I'll
a
link
really
that up.
that's a good way to take it in a situation.
Yeah. And the second thing is you want to use I, which is the ice.
Yeah.
And you want to show how a good position to put that in,
Yeah.
Brad?
Yeah. See, the reason I was confused, Bob, because I think we talk about the rice or the price program.
Yeah.
Pretty similar to this.
But this is taking AIM.
Aim. Yeah.
Yeah.
We're not going to rice it. We're going to aim it.
You want to use that chair? Oh, this tool maybe.
Yeah. Now, at home, if you got a nice carpeted floor and you got a nice
Ottoman or
ottoman
couch.
or a couch, something you can lay down. You get your cold pack, right? I got right here. And typically, most people with a back pain, when they're in this position, in a relaxed position, and they put this on that cold, whoa, that's cold. This
Is a
should
wonderful
make you,
position,
Yep,
right.
it should make you smile.
You might have a little difficult getting into that position, but we'll talk about that. But this is a good way to start.
Right, and
So-
again, it should feel good. If for some reason it's creating pain, it's not for you. Most people are going to find it very comfortable.
And staying in that position, Brad, let's take this out. Then this goes to the third one, the M. By the way, I used to teach a back class, and a guy, I asked the class, what does the M stand for?
Yeah.
And the AIM. He said morgue. And I go, no, it's movement. You want to start
sure.
getting some movement.
Yeah.
So we do little trunk rotations here. This is one of the best ones we do. Just gentle, and you can go real small oscillations to start.
Maybe I'll go this way so they can see.
Yeah, real small. And then if it gets better, you can start going to larger ones. And if it hurts one direction, just go the other direction.
The pain-free range.
Right.
Yeah. I call them windshield wipers
Sure.
to my patients, and then
Oh, yeah.
It reminds me of, it's just one of those things, Bob. I don't
Well,
know.
in that position, Brad, while we're at it, why don't you show us real quickly how to get out of bed when you're in back pain? Because this is a tough thing for a lot of people to do.
Okay. So if you're going to try and get up like this,
You're going to hurt.
right.
It won't let you.
So we do what we call log rolling to start with. Imagine that your trunk is like a log and it's very firm and it's not going to twist and everything rolls together like a log. Okay. And then we're going to go to our stomach slowly. And then you're sliding off. Let one leg down till the toe touches right there. Then you know where the floor is. You're going to keep twisting. Then you're going to walk with your hands up. And then this foot over here that I'm wiggling, its goal is to touch the floor next while you're keeping your back straight like it's in a cast. And you're going to walk you up like this, like this. And that's how
I've told this story many times, but Brad showed me how to do this, and like a few days later, my back went out. And thank God he did, because I literally could not get into bed. I mean, because a lot of times we were taught just to go down into your side like this,
right,
and then roll over.
Yep.
I could not get into bed that way. I mean, it just hurt like you wouldn't believe.
Yeah, so I showed how to get out. Why don't you show them how to get in the reverse?
Well, it'd be just the same. You come right up to it, you'd bend down like this, and you'd walk your hands along like this.
Right.
Bring your leg up like this, and just slowly bring yourself down, and then you'd roll over
Yep,
onto your
exactly.
back. So, all right. Don't let your back go out. You've been warned. We've shown you what to do, and remember, we can fix just about anything.
Except for that broken heart.
Yeah, we can fix broken backs even, but we can't fix a broken heart.
We're working on it, though.
Thanks a lot.